you. What? Stop skin picking! It's not that easy. Have you ever popped a pimple? Have you ever engaged with skin picking? And I guess the big question is, have you ever felt ashamed about it? Skin picking can actually be a disorder, and it's not just about causing scarring or infections to the skin, but there's often a psychological component. And the fix isn't always just products or creams. Sometimes it's therapy. Sometimes it's other forms of treatment. But if you're struggling with skin picking, A, how do you figure out if it's impacting you or not? And then B, who do you go to? Like, what are you supposed to do? Dermatologists are experts in skin. Psychologists are experts in therapy and behavior. And psychiatrists are experts in medication. But have you heard of psychodermatologists? They basically combine these two fields together to help people who are struggling with skin conditions and the psychological repercussions that they can have. And yes, as someone who was bullied in school because of my skin and who had habitual picking issues that went undiagnosed for years, this is a very personal conversation to me. Let's sit down and speak with Dr. Ahmed. She is a psychodermatologist from the UK, and she uses her platform on Instagram and social media to help people be more aware of how their psychology impacts their skin. And she agreed to speak with me today to better understand what skin picking is, what is actually happening to people's minds and faces and bodies when they're going through it, and what can be done to help. Dr. Ahmed, it's such a pleasure to have you here. You are the psychodermatologist. And before we even start about skin picking, what is psychodermatology?
Psychodermatology is the part of dermatology where we treat the mind and skin together. So we're not only treating your skin conditions. So for example, we're not only treating your acne, we're also finding out how that makes you feel. And we're dealing with the psychological impact. And that can be in several ways. That can be just through talking about it. That can be through helping you with some psychological interventions. And in some cases, for some people, we can use medications as well.
Awesome. And I know a lot of people will say, of course, acne impacts the way we feel, but acne isn't caused, by our mind. It's caused by bacteria. I don't think a lot of people realize that there is a connection between the mind and the skin. What does that connection look like?
So the mind and skin connection is usually mediated by the stress axis in our brain. So the technical words for it is the hypothalamic pituitary adrenal axis, or the HPA axis. And the main outcome from this axis is that you get the stress hormone cortisol. So whenever you're feeling emotionally distressed, your brain will interpret that as stress. It will activate the HPA axis, and this leads to the production of several hormones, one of the most important ones being cortisol. And what we know about most of these hormones, and cortisol especially, is that they're pro-inflammatory. So they either cause or exacerbate some skin conditions because they affect the skin's barrier. So they make the skin less able to defend itself. They affect the skin's immune system. They can affect wound healing. They can increase the production of sebum or oil. And that's what sometimes is implicated in breakouts. And it also can promote inflammation. So all of this can be seen in the skin in various conditions. If the HPA axis or the stress axis is overstimulated or it's constantly stimulated, then what happens is you tip into something called chronic stress, which is where your body feels stressed all the time, even when the stressor has gone away. So somebody might say, well, yes, I did have this experience, but actually I'm dealing with it really well. I still don't understand why I'm seeing the effects on my skin. And my explanation is usually, well, the thing is the process has been started off and it's really difficult for your body to then turn it off. There is some good stress. So the acute stresses. So, you're running late for a meeting. So you have to, you're running for the bus, your adrenaline is going up. So you're looking a bit more, pink or perky or flush, you're sweating a little bit. This interpreted as, it looks like a glow on your skin, your eyes are wider, you're speaking a little bit more quickly, you're really in the moment. So that's like a good stress, but the bad situations are when this becomes a chronic situation and it becomes a vicious cycle, which is then difficult to turn off.
It's like if you have this stress response, it makes sense that for people who really struggle with stress issues or with skin issues, that they feel like they can't turn those thoughts off. Can you explain the relationship between stress, skin picking, and acne, and what people come to you for?
So the typical story will be that somebody was feeling extremely stressed about something, changing job, moving house, relationship breakdown. They then started noticing the effects of that on their skin in terms of acne or breakouts. Then they started to touch their skin. They started to focus on their skin a lot. They had these big spots or small spots. They wanted to press them and pick them. And then this starts to turn into a vicious cycle, because picking them made them feel better. They felt like, oh, okay, I've got rid of the pus that comes out, or I've got rid of the spot. But then you get another one, or you feel another one, and then this again. That vicious cycle starts again. And typically skin picking is seen in people that have got acne. We specifically have a term for this. It's called acne excoriae, which means a picking type of acne. It looks different to other acne because it might not present with the same sort of nodules or big pimples that you get. What happens is the person, what they perceive as an abnormality on their skin. So if we all touch our skin, you can feel little bumps here and there. But when someone has got skin picking, that bump is enough to trigger them into wanting to scratch that bump or pick that bump, because they're worried it might turn into a spot. Or in fact, it might just be some mild acne, which maybe people who don't have skin picking would leave alone and it would just resolve itself. But when you're a skin picker, you have a recurrent need to pick the acne over, or the spot or the bump over and over again, and that can cause skin damage. And what I will see, somebody will come to me and not necessarily walk through the door and say, I've got skin picking, or I've got acne and skin picking. They will say, I've got acne. And then I'll look at it and say, well, this looks a little bit different to normal acne. So are you picking it? And then there'll be a short silence and a guilty response of, actually, yes, I do pick it.
I love that you bring that up, because when I was first going through my severe acne, I didn't realize I had acne excoriae. And I specifically remember posting videos online about, my skin flaking. And people would make comments, your acne looks different than mine. It's flatter, it's more scabby. And it was because I was picking it out of a stress response. When patients come to you and have admitted that they've engaged in skin picking, what are some of the emotions or the feelings that come up, and how do you help them with that?
So there are different types of skin picking, and emotional skin picking is one of them. So this is a type of skin picking that has to do with either feeling anxious or feeling depressed. So somebody is feeling that way, they focus on their skin. It's almost like they take that emotion out on their skin. They feel a short sense of relief, but then another emotion takes over, because now they feel guilty for damaging their skin. So it's again going into this negative almost decline. Some of the emotions that are associated with skin picking will be anxiety, depression. Some people can just do it out of boredom. You can also do it out of habit. And the way you then feel about your skin. So there's a lot of self-esteem issues, and also a lot of shame, a lot of guilt and embarrassment about your skin. So I try and divide it up. So there's functional skin picking. Some people will just skin pick. They'll do it while they're watching TV. They may be doing it on their hands or another part of their skin. It doesn't interfere with their daily life. But when I'm seeing people that have skin picking, I'm normally seeing the other end of that extreme. So I'm seeing the people who are skin picking. Yes, you're right. They're doing it in their bathroom. They're concealing it from everyone. They're spending 2-3 hours doing some sort of makeup or cover up before they go out so nobody else notices. But actually what it's doing is it's impacting their quality of life, because that 2 or 3 hours they're spending covering it up, they could be doing something much more important, studying for an exam or preparing for some work presentation. So I try to make people realize that, well, actually, if you didn't skin pick, then you'd have this many hours a day to do something else with. You'd feel better this much % of the day. You wouldn't spend 30% of your day feeling sad and depressed about your skin. You'd be feeling something completely different, because you'd have the confidence to go out and do the things that you enjoy. So it's about your life impairment. And when we diagnose skin picking, there's certain criteria that you look at. And one of the criteria is that the skin picking is affecting your quality of life. When it's affecting your quality of life, that's when you should do something, or myself as a psychodermatologist wants to do something about it.
I love that you bring that up, because it really does depend on, is this just something that you're scratching at, or is it taking you away from everything else? And I know that as a psychodermatologist, you deal with cases that can be very severe. I mean, without sharing any personal details, are you allowed to share a story about someone who came to you looking for help and how that went for them?
Sure, I can probably share with you the typical type of story that I get. And usually it's a young female who has come in with acne, who's very distressed by her acne. And when we start talking about the acne, we work out that skin picking is part of the acne, and sometimes we can't work out which one came first. Was it the acne that came first, or was it the picking that came first? And they're desperately looking for a solution. And some of the things that I've heard are the person is not able to go for the job that they want. Their relationship has broken up because they're spending all their time looking in mirrors and in the bathroom picking at their skin, and their partner does not understand why this is happening. And picking for 15 minutes versus picking for 3 hours is a big difference in there. And many times I've heard the sentence, I know that I started in the morning, and then when I looked outside, it was nighttime. And this is where you really start to say, okay, this is massive. This is a really big part of this person's life, and they cannot control it. So we have to focus on the picking. The focus is always the behavior and not necessarily how they're doing it. So yes, I do want to know, are you using your fingers? Are you using tweezers? What is it that you're doing? But I also really want to focus on why this is happening. So if you have skin picking, you're more likely to have other obsessive compulsive conditions because it comes under the same umbrella. So I will always ask, do you wash your hands a lot? Or are you very, very neat? Do you have to perform a certain routine before you leave the house? And again, overwhelming responses are, yes, I am really organized. And yes, I do need to have these certain things done before I can do something else. I like to work in a certain way. So it starts to become a pattern. We also know that other conditions are associated with having skin picking. So some people who have ADHD have skin picking as well. People who have personality disorders have skin picking as well, because they also have a very difficult response to stress. So they don't deal or cope with stress very well, and they can again take it out on their skin.
Yeah. And you're mentioning a lot of these different psychological conditions, and it almost sounds like a lot of these maybe fall together or what's called comorbidity, right? Is skin picking itself considered a disorder? Or how do you look at skin picking, and how does a practitioner know when there's a personality disorder or something else that's going on that skin picking is a result of?
So skin picking in itself is a disorder, and it does come under obsessive compulsive disorders. It's one of the subsets of them, like repetitive hand washing, like hair pulling, like nail biting. But the issue is that it's repetitive and it's recurrent, and the person cannot control it. Otherwise, these can also be known as body focused repetitive behaviors. So it's definitely a condition in its own right. Once we've established that a person has got this condition, that's when we start to, and I say this in a pun intended sort of way, unpick. So it's about unpicking the picking. So why is this happening? Is it because of a traumatic event or some sort of PTSD? Is it because you've got an underlying personality disorder? If we, for example, identify that somebody has severe depression secondary to a bereavement, and then they develop skin picking, the skin picking becomes a comorbidity of the depression. Or it can be the other way around, where a young person got some acne, started to pick it and really focus on their skin, and then they delve down deep into a depression because of the way that they looked. Then your depression is a comorbidity of having the skin picking. So it is very individual, and that's why the psychodermatology approach is so important, because although we understand all of these conditions, everyone will have their own story to tell. And then again, the treatments that we advise also are very individual. So the unique point about psychodermatology is technically the practitioner in front of you should be able to do everything. And remember, people in these situations are severely psychologically impacted. It takes time to build that relationship and that trust with someone. So it makes sense for that person to receive all the treatment that they need from that one person. Now, psychodermatology is also a very team-based specialty. So I do have a psychiatrist, I do have a psychologist who I will call upon when I need help, but still I will be the person overall responsible for that person's care. But there will be cases where I'll say, well, actually, you need a lot more time talking about your social anxiety. Are you comfortable to speak to my psychologist and have a relationship with them as well? And then we will talk to each other about you as needed, and this will take your care forward. I can't think of anybody that's said no to that.
It sounds like full circle care. And so speaking of breaking that cycle of skin picking, if someone is struggling and comes to you in clinic, what are some of the treatments that are available to people and what tends to work?
So first is to understand the problem and to understand the trigger. So I normally tell people that, okay, you have skin picking, I can see that. And if I'm able to diagnose the condition that might have caused it, because sometimes it's condition specific. So if you really do have acne and the acne's made you start picking, then I'll say, okay, well, look, we need to treat your acne really well so that you don't have that physical trigger for you want to pick your skin. Then obviously it gets a little bit more complicated. Let's start talking about the emotional skin picking or the habitual skin picking. So I normally tell people to start to become more aware of when they're picking. And I ask them to keep a diary. So keep a journal and write down when you're picking, what you're feeling before you start picking, how you're feeling afterwards, because people again don't understand how often they're doing it or they don't realize when they're doing it. Then we have to think about introduce a competing behavior. So instead of picking, so when you feel your hand go up to touch your face or your arm, instead of doing that, I want you to do something else. And we try to use really simple things. So clench your fists really tightly and try and clench them for up to a minute and then release. So that way you're stopping your hands from going to your face or your arm or wherever it is. On top of that, you're also resisting the urge. So you're resisting the urge for up to a minute, which then diminishes the need for you to pick your skin. And also, if you are going to pick, that's okay. I have to say that's okay, but do it properly, do it safely. Make sure your hands are clean. Make sure you soothe your skin afterwards. Make sure you keep your skin nice and cool, nice and clean afterwards as well. Trying to also remove the shame of picking. So if you have to give into the urge, you give into it, but just do it safely and limit yourself. Only do it for 10 minutes. Don't do it for 5 hours.
Yeah. And it almost sounds like that shame could lead to feelings of guilt, which leads to more skin picking. So actually accepting and understanding that could be helpful.
Exactly. And it's this vicious cycle that we're trying to break.
If someone is looking for help with this, where should they go? Who do they turn to?
So it really depends. You can literally Google psychodermatologist and see what exists in your area. The other thing to do is to go to the national society that will be for psychodermatologists in your country. So I'm in the UK. We have something called Psychodermatology UK. There is also a similar organization in the United States. There's a similar organization in the rest of Europe. Those websites will usually have a list of practitioners. But the first things to do, if once you've identified you have the problem, you let your family doctor know and you ask them if they have any recommendations. You see a dermatologist and explain, I've got skin picking. Can you treat this? Or do you know somebody that can treat this specifically? Because I think I need more help than what a usual dermatology appointment can offer. And to be honest, most general dermatologists will probably be very grateful that you've told them that you're a skin picker, so they can help you better. So they're not just going to give you a cream and say off you go. They're going to say, right, I'm going to try and help you find someone. And I'm hoping that everybody has the right professional integrity to help you to find the right person to treat you. So there is a lot out there. It's about trying to find it and finding it in the right amount of time.
I think it is so important because realizing that is the first step to deciding whether or not this is impacting our lives and being able to get that help, which, thank you so much for helping by sharing all of this information with us.
Thank you. And again, thank you to your platform for bringing this up, because there are a lot of people out there that have got skin picking or that are engaging in skin picking who may not realize that there is some help for this. We know that between 1% to 5% of the population are skin pickers, and it's probably underreported. So the more widely we share this information, the more likely we are to help more people come forward and seek medical attention or seek psychodermatology types of consultations when they need them and not when they're 10 or 15 years down the line.
So Dr. Ahmed, if someone wants to look at your helpful posts on Instagram, or if they want to book a virtual conversation with you or take a look at what you do online, where can we find you?
So you can find me on Instagram, and my Instagram handle is at @the_psychodermatologist. I'm also on Facebook as The Psychodermatologist, and I have a website which is www.thepsychodermatologist.com, and you can submit your questions there, and I'm very happy to answer them.
Awesome. Well, thank you for answering all of mine. I love and appreciate you and the work you do. And I can't wait for you to speak on more skin conditions and psychological conditions in the near future. If anybody has questions, leave them in the comments. Bye, guys. Like Dr. Ahmed said, if you're ashamed of skin picking, let's work to remove that shame. See if there are any techniques that she mentioned that you can implement into your own life if you're struggling with this, or if you know someone else who is, consider sending this video to them. And if you think that you really need help, like she said, reach out to your doctor or see if there are any practitioners in your area that you can set up an appointment with. Always remember to be beautiful both inside and out. Show compassion to yourself because I know how much compassion and love you show to others. I love you, and I can't wait to see you in this next video. Love you guys. Bye.